Hi everyone. Good evening. Welcome to another episode of The Complete Wellness. So today it's like we're going to talk about a topic that a lot of us have either heard about or where people have been worried about their loved ones actually going through this. So a lot of us, including myself, just want this hourglass body, the flat tummy, the large butt, and then we want to have what's called the figure of eight or an hourglass body. Still, sometimes when I hear that people have died from this operation, it actually makes my body cringe. And then sometimes I wonder, like a lot of people that have signed up and have asked us to talk about this topic, if it's really worth it or if it's not really worth it. So today we're really lucky because we're going to be listening to two amazing plastic surgeons talk about their experience doing this. And more importantly, we also have a clinical psychologist within our means who will talk to us about why a lot of us are actually seeking this ideal body, like we want to call it. So first of all, I'd like to introduce Mr. Umatilo. He's a multi-award-winning plastic surgeon. He's actually the director and the owner of the Cryo Clinic, which is well-renowned in the UK. Umatilo is actually also known as the body expert or the body transformist. He's really experienced. He's done a lot of work on not just microsurgical complex reconstructive surgery, but also he understands what body contouring is when it comes to the UK. And a lot of people will say that he's actually one of the best plastic surgeons in the United Kingdom. Uma, welcome to this panel again. It's good to have you a second time. I feel really lucky to have you.
Thank you, Dr. Chichi. Thank you for the introduction. I'm very honored to be here. And thank you everybody for attending. It's a really great pleasure to have the audience, and thank you.
Thank you so much. So as we said when we started this the webinars, we said we wanted to have a system where we are actually doctors from different parts of the world talking about the same thing and collaborating. So today we've been really lucky because we've got within our means Dr. Mohammed Marouch, who actually is all the way from Abu Dhabi. It's actually 10 p.m. in Abu Dhabi and he's been operating the whole day. So I'm really grateful that you're here. He's actually a very well-known plastic surgeon in the Gulf region and has worked in places like Saudi Arabia, the UAE, Kuwait, and Bahrain. Currently, he's also been trained in both the UK and in Egypt. He then has a master's in plastic surgery. So when it comes to plastic surgery, he knows what he's talking about. He's not just kidding. And then he's also an expert in body contouring, sculpturing, and also does things like facial rejuvenation and laser treatment. Dr. Mohammed, thank you so much for being within our means. And I know we're keeping you awake after you've operated the whole day, but we're really privileged to have you today. Thanks for coming. We can't hear you. We need to unmute him, I think.
Hi, good evening.
Mohammed, yes, we can hear you.
Can you hear me? Yeah, thank you very much. I am a pleasure and honored to be with all of you today. And it's the start of the cooperation with everybody around. Let people get the information, the right thing about the plastic surgery, because I feel there is some confusion in the concepts with the normal people. As you said in the introduction, if it is risky or lethal procedures, or it can affect the health of the people. So let's put the clear vision for everyone to help everyone to take the right decision when it comes to cosmetic surgery.
Thank you so much. Our next speaker has been someone called the Dove model, and it's really important to me to talk about the Dove model. And literally, when I remember, I think about the Dove model, I think about the Dove campaign that talks about people's unique differences that need to be celebrated, right? And more importantly, that our physical appearance should be transformed from a form of anxiety to a point of confidence. She's a known consultant clinical psychologist, and she's someone that is also called the radio agony aunt. So if you want to talk to someone when you have an issue that you're dealing with, is what speaking to this lady. The more important thing is that the first time I heard about her, I went to Google her name because I got introduced to her through someone coming, but I'll explain that later. And she's been on Good Morning Britain. She's really sought after, not just in the TV in the UK, but also in the radio, which means that what she tells us today is she's talking from a place of authority. And I think that's understanding the psychological reasons why we do the things that we do to our body and our health is so important. And therefore, I'm really grateful that Dr. Anu Sahal Bennett's been able to join us today. Thanks, Dr. Anu. I'm not sure you can see us, but we can see you, and we're happy to have you here.
Well, listen, I can't see you, but you know what? I'm going to make the best of it. But I'm really very, very honored to be, joining such a distinguished panel, because, this is a very important subject. And I think it's, wonderful to have this opportunity to have a conversation about cosmetic surgery.
Thank you so much. So Scott, can we go to the slides and start with the first slide? So I was going to share something with everyone, right? When people started talking about, should we talk about BBL or talk about tummy talk, there's something that came to my mind. I always try to research about things that happen before we go into these conversations. And literally, when I Googled about what people think about Brazilian butt lifts, the picture that came to my mind and came to everyone's mind that people talk about is actually the peach. And I'm just going to show you guys a picture of the peach because it's very important to see this. Perfect. So the Times newspaper described this as having this peachiness being put back into you because you don't want to have the saggy bum anymore, and you want this bum that is firm. And we need to remember that we also sit on our bum a lot, so our bum is really important to us, and it's really important that we get it right. Now, for a lot of us, there are other people that we look at and we say, oh, maybe we want to look like them. Can I have the next slide, please? So the person that comes to my mind easily is Kim Kardashian. Everyone wants to look like Kim Kardashian or J-Lo, right? And I didn't realize there were different types of bums till I thought about Kim Kardashian. And it talks about whether you want a H-shaped bum, a V-shaped bum, a love-shaped one, or a round one, right? But then there's something else that was alarming that I read about. Can I have the next slide, please? People say that, and obviously scientists also and doctors say that the Brazilian butt lifts are the deadliest of all aesthetic procedures, and the risks are really a lot. And even with the new technology, there's also a lot of the death rates are really, really, really high. So I'm just going to start out now by asking Omar Tilo the question of if he could describe to us what Brazilian butt lift means, please.
Brilliant. Good.
Because can we highlight the speakers now, please? Sorry, Omar, we're just going to get you on the screen so people can see you. Thank you. Yes. So can you explain to us what Brazilian butt lift means? And
so yeah, Brazilian butt lift, or what is known as BBL, many people call it BBL. It's a procedure where some fat, the extra fat, is removed from parts of the body which we don't like or we don't want it, such as the stomach or the flanks, and then that fat is used and transferred to the hips and the buttocks to augment those areas. So take the fat from somewhere we don't like, and we put it where we want it to be bigger on the hips. So most people ask for it to correct deficit of volumes, like the hip dip, but so-called hip dip, so to achieve more hourglass, as you alluded to, or to get a fuller buttock. They feel like their buttock is deflated, and they want more roundness, the peach-like kind of appearance. Very few, some people, they want a specific shape. So as you rightly said, there's the right shape, the round, the inverted heart shape. So it's different techniques are used to it's using the fat tissue to transfer it to achieve that sort of shape. So that's overall in general. It's one of the procedure where becoming most popular. So it's one of the most growing popularity in terms of cosmetic surgery. So if you look at, there's an exponential increase in the popularity of this surgery. So year by year, there's about 20% increase. So you expect in 3 years it'll be doubling, and it may overtake many other cosmetic procedures. So it's one of this really getting increase in popularity.
so I think that a lot of people wonder sometimes, we normally can put people to sleep. That's called general anesthesia, or we can numb a bit of the area to be able to do the operation, or we give people local anesthesia just to numb that area. What type of anesthetic is used for this operation? And do you think that actually impacts in any way about the outcomes and why the death rate seems to be quite high?
Sure. So as you rightly said, there's different types of anesthetic which is used. So depends on the facility where you go. how much equipment, how much they're equipped to deal with type of anesthetic. So there are some places who they do everything under local anesthetic. So local anesthetic meaning patient is awake. They have injections to numb the area where the fat is removed. But the patients be fully awake. Some places use sedation. That means the patients can be in and out from sleep, or they can have a full general anesthetic when the patient is fully asleep. So it depends mostly on how much fat you're planning to remove, how much fat you're planning to put in, how big is the area you're going to treat, and how much the facility is equipped to deal. And obviously, the bigger the surgery, the more anesthetic you need, the longer the surgery it is, longer recovery, more risks and complications. So it's not a one, it's like off the shelf procedure. It can be varied and can be tailored to how much, what the patient needs and what the patient wants, and type of anesthetic varies accordingly.
I think I like what you talked about, that it's tailored. So it's not one shape fits everyone or one procedure fits everyone. And I think that's really important when people decide that they want to go ahead and do this operation. Because I think, like, especially in developing countries, the death rates are because everyone believes she went there, I can go to that same place and I'll get away with it. Not even checking if that person is qualified enough to do the operation itself. Because it sounds as if it's not the most straightforward thing to do. If you're going to have to get fat from one part and take it to another part. So I'm just going to ask Dr. Mohammed, I'm wondering, like, when patients present to you for BBL, what type of patients normally present to you saying they want Brazilian butt lifts?
Actually, different kinds of patients are coming asking for the butt lifts. Actually, I don't like the terminology of Brazilian butt lifts because at the end, it's not a lift and it's not Brazilian. It is sort of buttocks augmentation using the own fat transfer. So if we properly named the procedure, we have to say a safe surgery, safe subcutaneous fat grafting or fat transfer to augment the butt's area. Anyway, different kinds of patients are asking for this. Mainly, there is people having some changes in the butt area, either due to genetics or due to the effect and encroachment of the time and age over time, or especially people nowadays after massive weight loss, people are subject to bariatric surgery, lost much of that weight, either through the gastric bypasses or whatever it is. This massive weight loss will leave the buttocks area lacking fullness, lacking size, lacking shape, and lacking volume as well, and the tone. So all of these people are asking for the buttocks augmentation to restore the form of this area, to improve the contour, and to have better matching and better harmony with the rest of the body units. So we have to look at it in that concept, in this vision, not to reach certain shape or certain volume or a contour or hourglass or round or square or whatever. No, we have to look at globally, I mean, from all aspects, and see the difference in the anatomical structures for each patient, and to tailor and adjust the procedures that we will do according to the anatomic criteria and the need of the patients. This is my impression. So at the end, still, this is a kind of surgery, and to select the patient is the utmost importance of the whole procedure. So at the end, this is surgery, and the patient should be in a good health and to go for the buttocks augmentation. Why? Because the patient should be able to tolerate the anesthesia. The patient should be able to be in a good condition to heal well after that. And many factors put in consideration in the patient selection. And this is actually the secret of success and satisfaction for the patient undergoing such procedure.
Okay, thank you so much. I think I like what you said about safety is very important. So it's not just the plastic surgeons, it's also the fact that we need to make sure that clinically they're healthy. There's no other reason why they should have complications, so they're well prepared for it. So it's not like, I'm not just going to like a sweet store to go and just get some sweets. It's major surgery, and it's something that people need to think about seriously before they decide to go on it. And Dr. Anu, I'm not sure whether I know you can't see us, but we
doesn't matter.
We can't see you at the moment, but anyway, I'm going to ask a question. I think you need to change your camera so your face is showing. I was going to ask you a question. As a clinical psychologist, right? Do you see any patients that doing BBL at all? And if they do, why do they come to you? We can't see you. We can only see the couch, but maybe the camera needs to move.
Okay. Oh, I'm so sorry about this.
No problem.
But I'm going to carry on, right?
Okay, no problem. Yeah.
Okay. I do see some patients that want the BBL, and I think you yourself mentioned Kim Kardashian. My impression is it's not necessarily her bottom that they want. I think they want her lifestyle, her money, her fame. But I think the context these days is also that there's more emphasis now on, curvy girls, plus size models. And, because of social media, because of, cosmetic surgery, quite a few of my clients, want to have that look, that aesthetic.
Okay, that makes sense. So people are coming because it's just, I think there's a lot on social media. Everybody wants to look like somebody else, to be honest, isn't it?
Yeah, right? I think it's a bit sad, really, but there we are. We'll all end up looking the same one day. I mean, I don't know.
Sometimes I think sometimes when I'm on social media, I'm like, wow, we all look the same now. The same makeup, same eyelashes. Everyone looks exactly the same. But then I guess also people have a right to want the body that they want. It's just that they need to want it right, and we don't want it to impact on their health somehow, isn't it? I think.
Yeah. But I think the other myth is just because we change our body, it doesn't necessarily mean we're going to change our mind, our feelings, our lives. I think, that's one of the problems, isn't it?
Yeah, exactly. Uma, I was going to talk to you about patient selection, but I think Dr. Mohammed talked a little bit about that. But I was going to ask you a question, right? Are there any considerations you would put in place in terms of, is there like a body habitus you look at? Is there a body type that as a surgeon that you'll be concerned about before you say, yes, I can give you like, let's call it fat transplant, because some of us don't like the word BBL, right? So that's what we're going to talk about, since it's not Brazilian anymore. Yes, I'm not sure. Is there like, if someone was like morbidly obese, I know we talked about that in the past, but I don't know, how does that work? Like in terms of body habitus that we choose.
Yeah, so I totally agree with Dr. Maroof. So BBL is it's the wrong terminology, because it's not Brazilian and it's not a lift at all. So it's an augmentation, and actually it became popular in the States, not in Brazil, but here we go.
How did Brazil get the credit then? How did Brazil get the credits?
It's just how people call it. Social media made it.
I will tell you the story. How it's Brazilian affiliation. So basically, to go back to your question, is a good question in terms of the body habitus, how we choose patients. So the first is to look at, I think the first thing I look at is patients' expectations. What do they want to achieve in terms of shape? So it's very important. It's important what Dr. Anu was mentioning is first whether they are seeking it for the right reason. So again, it's not going to fix their life. It's about what do they want to achieve in terms of shape of the body, and whether their body structure, their skeleton, their body structure would allow us to achieve what they want to, what they think they can to achieve. So we look at, first thing is the most important, you look at their fat distribution, whether the fat distribution is external or internal. So some people they put on weight and the fat goes internally, which we call the visceral fat. Some people they have more external fat. So liposuction will get rid of the outer fat. It doesn't get rid of the visceral fat. So if I meet a patient where they have mostly internally, I would say maybe they may need to lose weight naturally first to get rid of the internal fat
and then we deal with the external fat by liposuction. So somebody who's obese, somebody with a body mass index more than 30, I tend not to do gluteal fat transfer, because those patients, they tend to have internal fat, visceral fat, which they need to lose first with the weight loss, and then we can actually target the external fat, remove it to get them the structure or the shape which they want. So the fat distribution, so that comes with the communication to the patient, listening to what the patient wants, and then with the examination, I can feel and assess how much fat tissue they have, and whether that amount of fat tissue which allow us to get the enhancement they want or not. So I think that's a key thing with looking at the body structure.
Okay. So I think that's what a lot of people don't realize, that visceral fat is also part of the whole body stuff. It's not just about whether your tummy looks flat at the end of the day. If you've got visceral fat, your risk is actually much more high, I assume, right? Because you've got other comorbidities. And I think it's a good thing to also say, I think what Dr. Anu said that is really important is that at the end of the day, it's not just about getting that body, it's about treating everything in totality, right? And I think having like a multidisciplinary approach that we always do, like having the surgeons there, the anesthetists, the psychologists involved, even the nutritionist, is so important to get what we want, to achieve it in a safe way. I think safety is important. And that's the whole idea of this conversation. Dr. Mohammed, I'm really excited and interested in hearing about the story of this Brazilian, how Brazil took the whole credit for the fat transfer.
Oh, this goes back to this story goes back to the early 60s. There was one pioneer Brazilian guy, the plastic surgeon. His name was Dr. Ivo Bitangui. Ivo Bitangui is known for every plastic surgeon, even the old plastic surgeons, the junior plastic. Everybody knows Dr. Bitangui. Why? Because he fixed at that time in the early 60s the first specialized world training center for plastic surgery. And one of the procedures they adapted in such center was to augment the parts. Okay, but it's not the reason why they call it Brazilian buttock lift. Actually, as I agree completely with Dr. Omar, this procedure has its popularity in the States. And what made it popular is United States. Actually, there was a learning channels for the medical issues in the States at that time, maybe in the mid 90s. 95, 96, and one of these learning channels has presented a program for the buttocks augmentation, and the lady volunteered in that program was a Brazilian lady. So they make a name for this part of the program as building a Brazilian butt, and people liked the program, and then it stuck in mind that this is the Brazilian butt. All right. So from here came the name. Not everybody. The Brazilians are not well known for the round butts or the big butts or the square butts or whatever. But it comes here from the culture of the people. So the popularity came from the United States, and it is adapted everywhere in the world. But the most important that is to respect the anatomical differences between different races. The European, the Caucasian, the Africans, the Middle Eastern, the Asian people. So we have to understand the difference in the anatomy. And as Dr. Omar has emphasized, I thank him for that. It's not only a matter of the fat under the skin, but there is the very important is the visceral fat. The visceral fat, which is inside the abdominal cavity, that we cannot deal with. And as he said, and I agree completely with Dr. Omar, and I respect his practice, as he said that anybody with the BMI, body mass index, more than 30, go first, reduce your visceral fat, and come to me to reshape and recontour your outer body and make it in match and in harmony. So this is the story of from came the terminology of the Brazilian butts. Back again, what was your question?
So I think you talked about it already. I wanted you to explain the story of the Brazilian butt lift, which you told us about.
Yes,
About
yeah,
how
okay.
one person from Brazil then took the credit for everything, which is interesting.
Exactly.
I asked Dr. Anu. I can't see Dr. Anu's video anymore. Dr. Anu, are you still on?
Oh gosh, I can see me. I'm still
Oh
on.
yeah, we can see you now.
Hooray!
Hey, nice to see you. Can you see us now?
Hooray! I can see you.
Hooray!
Yay!
Perfect. Nice to see you. Thank you. Thank you. Thank you. Thank you for being here. Now I can. So funny enough, it's so nice I can see you now, because the most important question that I had for you was, can you tell us about the body dysmorphic disorder, where people, will you shed some light on that body dysmorphic disorder? That's a big thing now, I think.
Very big thing. Now, body dysmorphic disorder is a form of obsessive compulsive disorder, form of anxiety. And what it means is that the sufferer has a completely distorted view of maybe a part of their body, the whole body. They completely sort of overestimate some sort of I don't know, some sort of defect. It could be, I don't know, their nose is too big, their ears aren't right, the whole body is ridiculous. But the point is, other people just can't see that. It's completely disproportionate. And the sad thing is that the person will constantly scan their body. They might even measure the part of the body. And all of that obsessive checking will affect their mood and how they feel about themselves, how they feel about their life. But as well as that, if they're not feeling great, if they're depressed, if they're anxious, if they've got really low self-esteem, they are probably going to, suffer even more extreme body dysmorphia. So it's a form of OCD anxiety, basically.
So when Dr. Anu talks about it, I was just thinking, Dr. Umar, how do you recognize patients that come to you for fat transplants? How do you say, maybe this person's got like body, I know you guys work together as a team, which is great, which means Dr. Anu will always contribute to your patients. Is there like signs that you see as a surgeon? Because let's assume the psychologist wasn't there, because what I'm trying to stress is the fact that we need an MDT for each of these patients, right? We don't need one person taking a decision for them. It's supposed to be patient-led and patient-centered, but a joint medical and the patient decision. How do you spot out that there's something wrong and you say, okay, listen, these are alarm bells. I need to speak to Dr. Anu, come to my rescue. How do we make sure this is right? Because as what Dr. Anu just describes, they'll never be happy. So you give them, they look like him the next day, they come out, they're still not going to be happy. They still see their old self, right? How do you deal with things like that?
Kathy, so that's a good question. As plastic surgeons, a very big part of our practice is dealing with the psychology of the patients, is why they want the surgery, what do they think they will achieve from the surgery. That's very important to ask. So there's two ways really to answer the question. So there are like screening tools. There are questionnaires which we tend to ask all our patients to fill. So those questionnaires ask about how much the condition is affecting their life, how much they think about this, they're occupied of it, how much that they think about it, how many times a day, and they can assess how much they feel or they believe that condition is stopping them from doing what day-to-day activities. So then we take that tool and I listen to the patient. So then I see, I look at the problem which they describe and I see, is it really a big, if you compare it to the general population? I won't call, there's no normal and abnormal. I would say it's, how is it compared to the general population? Is it really out of ordinary or not? Is it something which is really easily to fix? So that's the first thing. So if it is significant, that's one thing. But if it's not that visible, I start kind of thinking is especially if the patient gives it a lot of weight, a lot of emphasis. Patients thinking 150 times a day about a tiny problem or something which barely visible, and then if we see that problem, or what they call it as a problem, is stopping them from going on with their day-to-day activities, stopping them from going to work, stopping them from interacting with people, then again it's another kind of alarm bell. I think so.
Let's bring Dr. Anu to the rescue.
Exactly. So the more it's a minor problem, and the more it's affecting their life, that the more, especially if they already had previous surgeries. So the common pattern, if a patient who had multiple procedures and they're still not happy, they feel they want more and more, and they start from one thing and they go on with other things. So these are signs which tells me surgery is not the answer. It's actually it's how they deal with the problem. It's their psychology. How do they accept those problems rather than trying and fix it by surgery?
Okay. That's good. I think when you were saying, there's something I just realized I was going to ask Dr. Mohammed, right? So we talked about the fact that, I don't know, weeks post-op or maybe months post-op, they're like, this is not the body I want. But what about when patients wake up from surgery immediately? What are the things after surgery how do you get them ready? Like, you know, they come in, they've got a bit of swelling, they've got like some redness or discoloration. How long does that last, and how do you deal with that with patients? I don't know how they're prepared, because initially they don't come out and their pitchiness is there, isn't it? It's
Actually, I get your question. The how to solve this problem? We solve this problem before the surgery. We started before the surgery. We have, as Dr. Omar emphasized, we have to explain everything in details to the patient. The patient should be fully informed about all the details of the surgical interventions that we are going to do inside the operating room, and what to expect after the operation, in the early post-operative period, in the late post-operative period, what he will face, what he will complain of, everything. In the early stage after the surgery, in the first few days, there will be some swelling, some soreness, some bruising, both in the area where we collect the fat and harvest the fat, and both in the area where we put and transfer the fat. All of these things happen, and we usually explain to the patient, and we instruct them for certain tricks, certain practices which manage these symptoms that they have. First, we ask the patient in the early days, especially in the first couple of weeks, not to sit much on the pads. So, I mean, it's not allowed to apply any sort of pressure on the pads during the first couple of weeks. Why? Because the new fat, the new fat came and inserted and transferred to this area, will survive developing the blood supply from the surrounding soft tissue. The surrounding area in the pads, where we put the fat in such plane, will create and develop new blood vessels. And these new blood vessels are fragile in the beginning, and the transferred cells are very delicate. So we don't need to apply any sort of pressure during the first couple of weeks until these new blood vessels will be well established and survive the transferred fat. So we can avoid some sort of problems. Secondly, usually we ask the patient to walk and to stretch the legs. This is very important to improve the circulation and to prevent the blood clotting, which is one of the common complications that might happen after the kind of surgery. We instruct the patient to stay well hydrated, to drink lots of water, plenty of fluids. Okay, this is helpful as well. And we instruct the patient as well to put the girdle, which is a pressure garment, or the body garment, all the time. Now, of course, she removes the garment every day and she has a shower and then put it back again and so on. Some of the patients we insist and instruct, they have to use the compression stocking net, which is starting immediately next morning after the surgery. And this also prevents blood from clotting. We give the patient some medications, of course. We give them some antibiotics. I personally give some clindamycin for a week or so to prevent any possibility of the infection and bacterial contamination of the wounds. I give them some medications to help the body response, to minimize the swelling, some pain control if they need. All of this will help the patient to pass the difficult period of the swelling and soreness after the surgery.
How long does that swelling period last for? And that bit, does it have a
actually the patient? Yeah, actually, it takes the first few days. Actually, the patient should go back to the normal activity in life in a week time or so, and she should be back to work. If she's working, she should be back to work within a couple of weeks. Okay. That's usually what we instruct them. It doesn't take that long, especially when we properly select the patient, which is healthy and good candidate for such kind of intervention.
I think that from what he talks about, I hear a lot of things about, and even Dr. Omar talked about it, and Dr. Anne also talked about it in terms of the proper patient, the proper selection,
yeah,
preparation.
The point is success comes from the proper selection of the patient. That's why the junior surgeons, and we always instruct them, who is not to do the surgery. Not every patient coming asking you to do the surgery or the parts augmentation, you accept them. There is some patients you should not allow them to go for this procedure. Some people like having comorbidity, having serious existing chronic disease, a heart disease, diabetic patients, patients who are heavy smokers, patients having blood clotting tendency and blood diseases, obese patients, morbid obese patients, because these patients having more possibility of developing some complications. And the most important, the point that Dr. Omar has mentioned, which I like it, to have the realistic patient. Any patient have unrealistic expectations should not go for this procedure. It is contraindicated to operate on unrealistic patient. Why? Because the patient should understand, as in all other cosmetic surgeries, the patient should understand that if he wish an outcome which is not attainable through the surgery, he will be in a great disappointment after the surgery. And this is much worse than major complications, because the patient is doing such kind of surgery for a better quality of life. If he is not realistic, of course, he will not achieve what's in mind, especially these days with social media and what they see in the social media, which is not true sometimes. So we have to bring the patient to ground and to let them understand what are the limitations of the surgery and what we can achieve for them according to the anatomy they have, according to the different layers, the skin elasticity, the amount of the fat under the skin, the muscle tone, the volume of the muscle, the fixed structure of the scaffold inside the bones that we cannot change. All of this should be explained to the patient before the surgery. So not everybody asking to go for the procedure, we accept.
Okay.
The good thing that, the good thing that for the plastic surgeon, when he knows when to say no.
I like that. That's a good phrase I'm going to take out for everyone. It's like when the surgeon knows how to say no. So when the surgeon is saying to you, no, you can't have this operation, it doesn't mean that they're joking. They're experts. They know what they're talking about. You don't then go to call a friend and the friend says, oh, but this man did 100 of it and I got okay. And then maybe your case is not going to be that way. I think the next question, from what you talked about DVT, and that's deep venous thrombosis or pulmonary embolism. Yeah. As a clot in the legs or a clot in the lung is a risk factor. And then we talked about that infection could be a risk factor and therefore people get antibiotics. I think what's sad for me is that for a lot of people that live in developing countries, the mortality that comes from fat transplant surgery, tummy tucks, it's alarmingly high, right? Personally, I've had personal experiences of losing people I'm close to, that my friends that maybe from, I don't know, from school, from different places that I've met along the way, who actually went to some botched surgeon that says they're a surgeon. By the way, they did a course for 5 minutes, right? And they've literally lost their life. And I think, Omar, I want to ask you, what is it that causes this high mortality rate in these patients, right? And I think from there, we'll swing into something else that I was going to ask. Why are people dying so much from the surgeries, even in the best hands, and still people are walking around winging a scalpel and thinking it's just simple surgery when it's not.
That's a good question. I'll just add my voice to Dr. Maruf, the comment about when not to do the surgery. They say a good surgeon is the surgeon who knows how to do the surgery. A better surgeon is the one who knows when to do the surgery, but the best surgeon is the one who knows when not to do the surgery.
I like that. Good for you.
So that's
good. That's good.
So I was asking about mortality rates.
Mortality. Yeah. So exactly. So mortality, it's BBL
death
an
rates,
operation which is linked with high mortality rates, because if you look at it, it's many things can go wrong with the surgery. It's a big surgery, involves liposuction. Liposuction involves big areas of the body, stomach, back. Many things can go wrong with that if the patient, doing it in the wrong patient, and if the surgeon don't have the right experience. The fatty transfer on its own, it carries with it high risk. So it could damage the nerve, could damage the artery, you could inject the fat into the wrong place. It's a long operation, and long operation has many risks to do with temperature loss, bleeding, infections. Afterwards, also, if there's any infection, can go really bad. So it's a surgery which has many risks, but the most common complication which been linked to BBL is fat embolism. So that meaning if a fat was injected into too deep into the muscle or under the muscle, and if it leaks into the vein, and that can travel into the bloodstream and can block the artery to the lung. And there are studies to show that the risk of fat embolism in BBL is 1 in 2,000, which
that's a lot. Yeah.
Very high. Comparing, if you think like the risk of dying from any other cosmetic surgery is 1 in 100,000, 1 in 2,000 is very high.
That's a lot.
Now, there is a reason for, that now there are, so that's now we know more about it. We know why it happens. We know that if we inject the fat into the muscle, it can leak, can go into the vessel. That's why now we do all the transfer subcutaneously over the muscle, which if it's done properly, then we think the risks of having fat embolism is as low as any other surgical procedure. So that's to say, it's many things can go wrong, and if it's not done in the right way, carries many risks.
I think I think the word is the right way by the person that is experienced to do it, and also being medically optimized, not just medically, but also psychologically. I'm going to take a question because people have been sending questions. And Dr. Anu, this is a question for you actually. One of those attendants is saying, how would you approach a patient with other mental health conditions such as autism, where a person with autism becomes hyper-focused on BBL or fat transplants?
That's a really interesting question, isn't it? And I think it brings up issues of sort of informed consent, capacity. I mean, I'm not generalizing about people with autism, but it might be that one particular person might just be very obsessed with having a particular cosmetic treatment. And again, I think, this is where it's really important to be part of a multidisciplinary team to make sure that the professionals, the patient, and maybe other people involved in that sort of patient support system come to a collaborative decision together. But I think in that particular case, I think there might be issues of capacity and consent, really.
And when you mean capacity, you mean that maybe there's a problem with understanding, isn't it? Trying to.
It really might be. And I think what we've just heard before from our lovely eminent surgeons is that, such a comprehensive, thorough assessment is just so important so that any ambolites can be detected. Yeah.
Okay, thank you so much. And Dr. Anu, before I'm still going to ask you another question, which is we talked a lot about this death rate, high death rate, 1 in 2,000. It's a lot for anyone, because when you say that in other cosmetic surgeries, 1 in 100,000 people, it means that it's a lot of people are scared of dying, even though people still go to do them because they're thinking about their body. Do you get people that come to you specifically because they're scared of the death before the surgery?
Not,
how do you deal with that? I don't know. What are that?
I don't think I see people that are scared about they are worried about. Of course, they're worried about things going wrong and dying, and they're anxious. And, we just need to, just give them as much information as possible, because we cope better when we know what's likely to be in front of us. But there are some people, and when you start talking about, mortality rates of, 1 in 2,000 or something, they're actually going to opt out. And that's no bad thing. Maybe that's no bad thing, but I think we have to give them the facts and the statistics. And for me, just doing a bit of anxiety management, that's not going to help at all, is it really?
Exactly.
Surgery, it's got risks. Yeah.
Makes sense. Makes a lot of sense. Now, I know we talked about mortality rate being really high, but things like what came to my mind now is that people that have breast cancer and have had breast cancer surgery also have fats injected in their muscles for reconstruction, but their death rates are not that high. So I was going to go back to you, Omar, because you talked about the death rates. Why is it that things like breast fat injection into the breast doesn't cause so much death rate as fat transfer for cosmetic reasons?
Good. So again, as Dr. Anu highlighted, is any surgery does carries with it risk. So there is also, even with fat transfer to the breast, there is the risk of fat embolism. Even with liposuction, there's the risk of fat embolism, but it is much lower than what's been happening with the fat transfer. And it's mostly to do with the anatomy of the area. So if you look at the gluteal area, the veins, the deep veins are quite big. And they're fragile, thin-walled, and if the fat gets to the area, they can avulse, can break, and the fat can leak much easier. You look other parts of the body, unless there is a vascular problem in the area, the veins or the vessels are much smaller, less likely for big fat lobules to go through those vessels. So it's mostly to do with the anatomy.
Okay. Thank you. So it's more because of the area. And when you talked about gluteal, for people that don't understand what gluteal means, is like the buttock, the muscles around the buttocks, right? So that's what Dr. Omar just talked to us about. I'm just going to recap. If you've got questions, there's the Slido QR code that you just need to scan and send your questions. And then I think today we've had a bit of a technical problem, so I'm going to just say, a lot of people have struggled to log in. I'm not sure why, but we're recording this, so we'll put it on YouTube so people can follow up, and we'll share with people. If your friends can't log in, because my phone keeps buzzing, like I can't log in, I'm not sure what's going on, but we will share this so people know, can recap and just do it at their own time. Dr. Mohammed, I've got a question for you. So I know we've talked a lot about this fat transplant in terms of cosmetic surgery, but I also know that maybe there are other indications where you have to do fat transplants. For example, someone's had maybe like a pelvic trauma, for example, pelvics in terms of their hip trauma. They're a little bit like, they don't like how their pelvis looks. They're finding it difficult to wear trousers because there's some deformity, or maybe, as you said already, serious weight loss. Do you see a lot of those patients also coming to you because they're not, okay, obviously they're still doing it for cosmetic reasons, but they're doing it because they can't wear something as simple as a pair of trousers?
Yeah, I will get to your question now, but if you allow me, just a small addition to the mortality and the death complications from the fat transfer. Actually, the statistics of 1 in 2,000 or 1 in 3,000, or the reputation of high mortality, which is associated with the fat transfer, is not that accurate. Why? Because it comes in conclusion that who is doing the procedure. Most of these complications are not happening with the licensed or professional and experienced and knowledgeable surgeons, or people are practicing in the healthcare facility which is eligible and accredited. But most of these mortalities are coming from the people practicing what we call low cost and high volume. Low cost and high volume, like shops, okay? So people cannot afford sometimes the cost of the surgery, so they go to less trained, less certified, less experienced, and practicing in less prepared facilities, and they don't know what they are doing exactly. As Dr. Omar said, they might go and inject the fat through the muscle, they might go even below the muscle, and this gives high possibility of the fat cells and fat lobules to transfer in the vessels, and then go to the heart, and then go to the lung, and then produce the fat embolism of the lung. And here it comes this, because the lethal complication or lethal fat embolism, if it is lethal, it happens mostly on table inside the operating room within few minutes of the injecting of fat. But there is some less minor fat embolism that can happen maybe 24, 48 hours, and this is not usually fatal. So if the people adapt a policy to go for the experienced and licensed and professional plastic surgeons to do the procedure in respectable place, which is well prepared. Actually, I'm practicing this fat transfer over 22 years. In our practice and in my colleague practices, we actually, you don't see it, but we heard about it in such small center, in such rural area, in such low-cost surgery. So this is your life. Don't risk it. Don't risk it. All right. Back again to your question. The people after the trauma and after pelvic trauma or whatever, and they will be. Hello.
Sorry about that. I'm not sure where that went off. Yeah, we can hear you, Dr. Mohammed.
Yeah. So these kind of people after the trauma, actually, we wait for them until they completely healed and recover from the original pathology and accidents that they have, and then after at least 6 months to 1 year, where the soft tissue will come down and more the final shape will be there, we can manipulate and measure how much we can use the fat to improve the contour, to cover the defects, to provide some soft padding for some areas. There is many utilization of the fat transfer in such people. And usually we see these people coming from the orthopedic surgeons to us to improve the general appearance after major trauma.
Okay. Thank you so much. I like what you talked about, because I was going to touch on that in a bit. What you talked about, going to the right center, being treated by the right surgeon. It's okay if social media shows me, I don't know, whatever, I want to be Kim Kardashian or J-Lo. I keep referring to them because everybody, since they've come up, everyone wants to be like them, right? And people don't want to be like themselves anymore. But then these people are spending a lot of money to get the body they want because they're going to the right centers. They're getting proper surgeons to see them. And I'm just going to touch a bit about medical practice. So you go to medical school, depending on where you go to, the average length of stay in medical school is between 5 and 7 years, depending on whether you go to medical school in what country. Then you go on ahead and do like initial training for 2 years post medicine. Then you go into higher specialist training and do like 5 years, 6 years, depending on what you're doing. And then subspecialize in doing body contouring, for example. So we're looking at people with experience that have studied this medicine for more than 10 years. Do you understand? And then somebody comes out to you and tells you, I just finished medical school 2 days ago. I've just gone to this course, this short course, and all of a sudden I'm like the specialist for doing liposuction. The truth is that people are dying because they're putting their hands in the hands of wrong people. And the whole idea why we're doing this webinar is to tell people that, one, it's not a walk in the park, right? And if you're going to take this walk in the park that you think you want to take, you've got to take it in the right park, if that makes sense. I don't know how else to describe it. You've got to go to the right place, get it done. The body that you want, it's costly, it's not cheap. And therefore, if they're giving it to you for cheap, there's something wrong. It's not the same as, I don't know, like as the price value or something. It's not value. Value is never the same as the same thing. I always say, there's a big difference between a Ferrari and a Toyota, two different things. And we're not trying to encourage people to go and do surgery. But what we're saying is that if you decide that you want to do surgery, you've seen your surgeon, you've seen a psychologist to make sure that this is what you really want to do, then you really should go to the right. And if you cannot afford it, your life is not what's being butchered by one other person and being a statistic number. It just doesn't make sense. And I think since we're talking about price, it's worth mentioning how much this really costs. Like for the Omar, what is the average cost of someone that wants to do like fat transfer for the butt?
So it mostly depends on the duration of the set. It's depends on the duration of the surgery, and that's related to how many zones of liposuction, how many areas of liposuction. So it starts for around £5,000 if you're doing 1 or 2 zones to transfer to the buttock, and it can go up to £10,000-12,000 if kind of 360 with many multiple areas. But that surgery can be like 4 hours, 3-4 hour surgery, long surgery. So this is usually the range for the BBL.
Thank you so much. I was going to come to you, Anu, and say, let's assume this patient's had like the surgeon. I'm going to come back to the surgeons also. And they come to you, as we talked about body dysmorphism already, and they come to you and they say, you know, I don't really like this body anymore. I shouldn't have started this journey. Do you think that it's better people see a psychologist from day one before they embark at all on the journey? I'm not sure what your thoughts are on that.
I really do think it's important, because this is all part of having a sort of comprehensive assessment. You know, there are some patients, you know, that are very depressed, they're very anxious, they've got eating disorders, they self-harm, they've had trauma, they've had abuse. And, you know, having cosmetic surgery, whether it's tummy tuck or whatever it happens to be, it's not necessarily going to, you know, heal them. So I really think it should be, you know, I think Omar's terribly good. He you know, he recognizes when some patients might not be suitable. And, you know, I think it's just to do with our sort of duty of care. I think it's about being an ethical practitioner. I think there has to be an opportunity for the potential patient to really have a good look at, you know, the reasons, their expectations, because otherwise, sadly, somewhere down the line, you know, their life hasn't changed. And, you know, they're going to get into litigation or something against.
Exactly.
So really, let's just do our, you know, let's do a thorough risk assessment right from the beginning of that journey.
Thank you so much. I think we're supposed to have talked about tummy tuck, but I think we ran out of time, to be honest, right? Because I just realized, well, maybe we're far reaching. So I think we'll have to come back to that conversation later. But before we leave, I was going to ask Dr. Mohammed, let's assume you've done the surgery for this patient, and I'm also piggybacking off Dr. Anu's conversation, and they come back to you and they say, I completely hate my body. I need you to reoperate on me again. What would you do? And they say things like, I want you to give me back my old self, for example, my old body. What happens then? Have you had that experience before, and how do you guys deal with this?
Actually, to avoid having this experience, as I said, first all, you have to properly select the patient's ideal candidates or good candidates for the surgery. And we usually take the psychology and psychiatry consultation regarding that. When we feel that this patient is having some issues, or it's not the usual, or they having some unrealistic expectations, all of this to avoid the point that you are discussing now. So the careful selection of the patient, and then we have to spend good effort in thorough examination of the patient, starting from the skin to the fat, to the muscle, to the bone, everything, and to put the whole image of the patient in front, in the harmony of the units. It's not good to have the butts beautiful, but it's not matching and not in harmony with the other body units. We have to put it all together. Sometimes, and this is real, sometimes there is a lady which is 85 or 90 kilograms, is more attractive and more sexy than a lady is 60 or 58 kilograms, but she doesn't have the harmony. She doesn't have the balance. She doesn't have the matching of the units together. So this is very important for the plastic surgeons and to understand. And it's very important from the plastic surgeon before the surgery to explain comprehensively and in details and to discuss it with the patient, everything, emphasize the possible outcome, what we can get, what is the most probable outcome results that we'll achieve in this specific case, because each case has its own merits. Oh, it doesn't apply one result. That's why I don't like to show the people before the surgery, oh, this is before, this is after, this is before, this is after, but it's beautiful, but it doesn't apply to my case, all right? So we have, the plastic surgeon should be honest and explain honestly and in details what is the expectation for such patient. All of this, if it happens in the proper way, you will get satisfied patient and avoid disappointment after the surgery. This is my technique in that.
Okay, thank you so much. I'm going to take one last question, which is, Omar, this is a question for you. So let's assume we've done this beautiful lifts, you know, the patients had a beautiful lift, and then a few months later, it starts sagging, right? Because I know that doesn't happen to you, but it does happen to a lot of the surgeons that are experienced, right? And the person says, what causes this and how can it be prevented, right? And I think they're asking this question, obviously, because I don't know who's done it. Maybe the fat has died of who knows what they've injected, right? But I'm just wondering, like, I don't know, how is that addressed? Normally, that's a question.
Good question. So first, patients need to know, to be aware that some of the fat will dissolve. So when we transfer the fat to the buttock, not all of it will survive. At least it's usually estimate about 50% of the fat will not survive, and 50 will. So part of the process of the healing is that the initial volume, when they start with very big, that volume will go down, and that's normal, that's natural. Now, an actual sagging drop, I mean, if it's visibly, you know, not within the expected amount of sagging, that can come to different reasons. It could be that the fat maybe wasn't harvested well and it wasn't transferred well, so that a lot of the fat didn't survive, or the patient may not be looking after the fat because it's also it's responsible. Part of it is responsibility of the patient to look after the surgery, not to sit, not to smoke, because all of this will kill the fat. And there are complications which can cause the skin to sag. So something which I see now I've been dealing with is something called blowout phenomena, which means when a lot of fat is injected in one area, and especially if the ligaments are cut in that area, what happens when the fat goes away, the skin drops and you get really sagging. And we call it, it's a new phenomena. It's something which we didn't deal with this, and we see it more and more now. We call it the blowout. And that to fix this, we'll have to cut the skin and pull it up, and it's complex surgery. And again, if it happens, we deal with it. And yeah, I mean, the more we know about the surgery, the more we know how to avoid these things and how to fix them as well.
Thank you so much. I think that's a really happy note to end, because one, Dr. Mohammed is like past 11 p.m. in Abu Dhabi, and you've been operating the whole.
It's all right.
Not,
it's my pleasure. Thank you.
And honestly, I'm going to have to invite you back, because we're supposed to be talking about tummy talk, but we've talked about not Brazilian fat transplant, right? And it's been amazing having this conversation. I must apologize again. A lot of people have struggled to log in, but they will watch this on YouTube. So if any of your people couldn't log in, please just let them know that we'll do that. And I want to thank you a lot, Dr. Anu. I think that having you on this team today has been really excellent, because one, I think people understanding that it's not just about the body, there's a bit of the mind that is so important in what we're going to do. If we decide to take any journey at all, it's so important. And I think having you on a team like Dr. Tilo is so grateful to have you, to be honest, because then that way people can actually understand that what to expect. And I think for even Dr. Mohammed, he has a team of psychologists and psychiatrists that he works with also. And I think it's all about scenario approach. Dr. Tilo, I cannot thank you. You're like, you know, like you're my person anytime when it comes to like plastic surgery. You're quite well renowned. I think the take-home message is that you need to, if you ever decide that you want to do this, right, it has to be well thought of. It has to be done in the right place. And again, you need to think about the fact that if world experts are doing it for quite a chunk of money, if you describe it as that, then if you go to someone that tells you it's just a few £100, then or a few $100 or whatever currency you're in at the moment, then there's something really wrong, and you should really run for your life, because the people don't expertise is not cheap. Is that the word? Maybe that's the word to use. Actually, it's all about remembering that your health is optimum, and no matter what, your mind has to be right for that body to be right. And I like what Dr. Mohammed talks about. It's not just about the buttock area or the butt area. It's all about getting the entire body to be together. And sometimes just body confidence is just what you need. It doesn't change who you are if your mind is not right and you don't see your body right. And so I want to just thank everyone that has logged in. And as always, I always try and negotiate a voucher for someone, because maybe we haven't had a lot of conversation, but you want to like still speak to this doctors one-to-one, then we're able to organize that for you. And I think my technical team have put that up. Today has been a really interesting day to talk about this. And it's something that a lot of people have talked about. And I love the fact that we're leaving it knowing that the death rates are not just because the experts don't know what they're doing. Death rates are because people that are not experts are claiming to be experts at the job. Do you all agree with me? I don't know.
Definitely.
Does that make sense? Yeah, I think so. And then I think next week we're going to be talking about cataracts, but I just want to say thank you to everyone again. Thank you so much for your time.
Thank
This
you very
hour
much.
has been a good conversation, honestly, Dr. Anu, and I'm so grateful to have met you.
And listen, thank you for organising this. Wonderful.
Thank
Real
you.
public service.
Thank you so much. That's the whole idea. And
thank you very much. And I would like to thank Dr. Anu as well. And big thanks for Dr. Omar for his really valuable addition and information in this subject. Thank you, Dr. Omar.
Thank you, Dr. Chichi. Thank you, Dr. Mohammed.
And it's all about collaboration.
Yeah. See you all soon.
Thank you.
Bye.
Thank you, everyone. Have a good night,
Bye.
everyone. God bless you. And thank
Have a
everyone
nice
for
evening.
joining.
Thank you.
And we apologize again
Have a
for the
good night.
technical errors today. Thank you.
Bye.
Thank you.
Bye.
Have a good night. Bye.
Bye.